close enough to it.
All right, good afternoon, everybody. We're ready to convene again, and if we can get the folks back in from the foyer outside. I've got my theme music going.
Heroic music.
So my name is John Balbus. I'm the Senior Advisor for Public Health at the National Institute of Environmental Health Sciences and a member of the Roundtable, and also proud to be representing the institution that's been the lead sponsor for the Roundtable through its 14 or so years. And we have the perfect antidote to the postprandial attention slump, which is three outstanding speakers to talk to us on the topic that our last session really teed up for us very well. Eric Olson said we needed to get the word out in the policy community about just what are the health impacts and the health implications of biofuels policies. So for the last 24 hours, we've been talking about the mechanisms and how biofuels can impact health, and now we're going to talk about the different tools that we have and the different approaches to actually answering the question of how much. We've seen the complexity, that there are a lot of uncertainties, a lot of range and impacts depending on the specific kinds of fuels, the processes, the region, the type of engine used to burn them, etc. We know we need a systems approach. We know we need a life cycle approach. There's complexities that we haven't even brought in yet, things like antibiotics. We know that a lot of antibiotics are used in the production of biofuels. Some of these get into dry distiller grains. They have implications. The dry distiller grains themselves have implications for the health of the animals. So very pleased to have this, as I said, outstanding panel of Roundtable members to be able to talk to us about the different approaches. I'm just going to introduce everybody very briefly, and then we'll just run right through. We have about 45 minutes, I think, for the whole session. So our first speaker will be Dr. Lynn Goldman, who's the Dean of the School of Public Health at the George Washington University. Dr. Goldman, as all of our panelists, has experience at high-level positions within the federal government and is perhaps best known for her role in helping to craft the Food Protection Act of 1996, which was the first national environmental law explicitly requiring measures to protect children from pesticides. So different kind of food protection that we're talking about now. Our next speaker will be Dr. Bernie Goldstein, who's Emeritus Professor of Environmental and Occupational Health, former Dean of the University of Pittsburgh Graduate School of Public Health, and also former Director of the Office of Research and Development at the EPA. And our third speaker will be Dr. Richard Jackson, who is Professor and Chair of Environmental Health Sciences at the Fielding School of Public Health at UCLA. And Dr. Jackson spent many years as the Director of the National Center for Environmental Health at the CDC. So with that, I'll turn it over to Dr. Goldman.